When cells are injured or damaged and die off, usually that dead tissue that was previously full of living cells becomes fibrotic, meaning it becomes thickened with heaps and heaps of protein and forms scar tissue. So when your liver is constantly forced to process alcohol, like an alcoholic liver disease, or subject to a viral attack for a long time, like an HBV, or anything else that causes a long-term or chronic state of liver cell or hepatocyte destruction and inflammation, your liver can become seriously scarred and damaged to the point where it's no longer reversible, at which point it becomes fibrotic, and in the liver we call this process cirrhosis. Because it's usually irreversible, cirrhosis is often referred to as end-stage or late-stage liver damage. When liver cells are injured, they start to come together and form what are called regenerative nodules. You can think of these as colonies of living liver cells. And these are one of the classic signs of cirrhosis and are why a cirrhotic liver is more bumpy as opposed to a smooth, healthy liver. Also with cirrhotic liver tissue, you'll see that in between these clumps of cells or nodules is fibrotic tissue and collagen. Here's a classic histology image of cirrhotic tissue. This clump of cells in the middle is the regenerative nodule, and these blue stains surrounding it are the bands of protein from the process of fibrosis. If we zoom out a bit and look at it with the naked eye, we'll again see these nodules, which have fibrotic protein bands in between. Alright, but how do these bands of fibrotic tissue form though? Well, fibrosis is a process mediated by these special cells called stellate cells that sit between the sinusoid and hepatocyte, known as the parasinusoidal space. Here's a pretty basic layout of the basic functional unit of the liver. You've got the portal vein and the hepatic artery that combine into a sinusoid, which then goes into the central vein. And these are all lined with hepatocytes, right? Along these, though, you've also got a bile duct, and all these three constitute a portal triad. So the parasinusoidal space, which literally means around the sinusoidal space, and stellate cells are about here. And usually, in healthy tissue, these guys' main function is to store vitamin A, and are otherwise considered quiescent, or sort of dormant. When the hepatocytes are injured, though, they secrete paracrine factors that activate and sort of change the stellate cells. When activated, these stellate cells lose vitamin A, proliferate, and start secreting transforming growth factor beta 1, or TGF-beta, which then causes them to produce collagen, which is the main ingredient in extracellular matrix, fibrosis, and then scar tissue. As this fibrotic tissue builds up, it starts to compress the central veins and sinusoids. It's thought that in a healthy, normal state, these stellate cells play key roles in the natural wound healing process. But when the liver cells are constantly injured, the stellate cells are constantly activated, and so they constantly produce collagen and factors that lead to fibrosis. And this is when complications due to cirrhosis start to crop up. As those central veins and sinusoids become compressed and push on the fluid inside, their pressure starts to build up, leading to intrasinusoidal, or sometimes called portal hypertension.